Hello, this is Dr. Guerra again from Holistic and Wellness Medicine. I get a lot of calls and a lot of emails and messages regarding our wellness program. People keep asking, what is wellness compared to pharmacy? The difference between pharmacy and wellness supplements is not one and the same. Please don't think it's one and the same or exactly the same because it's not. Sometimes pharmacy medication is needed for a holistic approach to occur. A supplement, a diet, a peptide, things of those natures. Those are one and the same to an extent, but it is not the same as far as medication. Sometimes pharmacy meds are needed for the human body, but not all. We do have issues that people do ask and issues that do arise when certain questions are being asked about, well, my doctor says I need to take this medication, but he or she doesn't want me to accept or eat a certain supplement. That's like almost saying that we want to give you a medication, but we don't want you to eat healthy. We don't want you to eat on a diet. We don't want you to be on the diet. This is where things get very bad for the patient and doctor's communication. Then they'll say it's miscommunication, or you misunderstood, or the nurse didn't explain it right, or the practitioner, the nurse practitioner, or the physician didn't explain it right. But they give you a document that has a list of things they want you to eat, but the physician or your PCP or your MD will tell you that, well, when we tell you that we don't want you to be eating a herbal supplement, or we don't want you to be eating a certain amount of food, but yet they give you a document that tells you you need to eat this, a certain salad, a certain fruit, a veggie, or whatever the case may be. This is where practitioners from our experts in our field, or a holistic approach, a therapy approach, is where we need to understand the difference between your medical issues versus the reality of your nutrition. Are you eating correctly? Is the medications that you are taking an OTC, which is an over the counter? Is it issued through a pharmacy? When was the last time you were hydrated? When was the last time you had some kind of respiratory issues that required the doctor to release you because you were on some kind of medication for respiratory symptoms, or vision issues, or taste or smell, COVID, things of that nature? There's a lot of things we look at to try a different approach. Um, Sometimes when you are on a certain medication, we have to look at the nutrition behind that medication, meaning that can that with that medication you are taking, can you eat these supplements or these fruits or these veggies or these herbs? Will it mix well with that certain supplement? Then when we analyze your labs, we look at the labs to justify the cause or the root cause versus what a medication manage and work with the remedies we will give you, the therapies, to keep it in simple terms. Sometimes, and other factors also do occur in these sometimes situations, is how old is the patient? Do they have any other medical conditions? What is their whole history like? These are just things that we look at for different approaches to help you from holistic and wellness medicine or other holistic companies or agencies. Sometimes when you are actually doing a pharmacy item, it could be very good. Doing a holistic approach doesn't necessarily mean it's supplements or nutrition. Sometimes we have a uh, a frequency, which is frequency therapy. We have yoga, we have tai chi, we have chiropractors, we have massage therapists. All of this plays a factor when it comes to your health. It doesn't matter what your age is; it all matters on what is your conditions. We look at the past 2 weeks before you come and see us, and then when you dump, excuse me, when you're with us, we look at 2 weeks prior to what did you eat? What things that happened? When was the last time your doctor saw you? What was your blood labs like? When was the last time you've been hydrated, which plays an important factor when it comes to taking medications of any kind, or herbs, or supplements. But on our website, we have a lot of things, a lot of information for you that can support your cause, regardless of what it is. It can be diabetes, it can be cancers, it can be liver failure, it can be respiratory issues, it can be neuropathy, swollen legs, swollen feet, um, so on and so on. I mean, we have a whole bunch of different programs for you, thyroid issues, joint health, and so on and so on. Our team of practitioners specialize in all kinds of different fields, including us. If there's something else that you have that I haven't mentioned in this video that you would like to know about, as what supplement with does what herbal remedy is a better solution rather than taking a pharmacy pill or an over-the-counter pill, we can actually assist in those matters. Again, it all depends on your background, your history, your whole medical situation, so on and so on. But if you have any questions and you'd like to know more about us, you can check us out, or you can send us an email or go through our chat line at holisticandwellnessmedicine.com. We're on Facebook, TikTok, and Instagram. We're available 24 hours a day. Please leave us a review or give us a comment. Any other questions you have, feel free to ask. Have a good day.